Joining us now to give us deeper insight into this pandemic-fueled mental health crisis is the National CEO of the Canadian Mental Health Association, Ms. Margaret Eaton. Ms. Eaton, welcome back to Forum Daily.
Thank you so much for having me again.
So let's start with how the pandemic itself has impacted mental health during the last 2 years.
It has not been good. We've been tracking this since the beginning of the pandemic, and the numbers have stayed fairly consistent, and they're very close to what Angus Reid has found, that our numbers show 41% of Canadians have seen a decline in their mental health. And that's consistent with what we're hearing on the ground. There are CMHAs in 330 regions across Canada. And one of the branches was telling us they feel like it's a whiplash effect, that things were getting a little bit better last fall, and then Omicron hit, and the phones started to ring across the country. So we know Canadians are really hurting right now.
And what would you say are the key takeaways from this recent Angus Reid study in particular?
Well, the Angus Reid study was so interesting because it said nearly half of Canadians say they're tired, they're frustrated, they're anxious, and 1/3 feel that their anxiety and depression is a major problem. It was interesting that 7% of Canadians say they're barely getting by when it comes to their mental health. And the number of people who were experiencing mental health issues had more than doubled since any other measure at any time that Angus Reid had done since October 2020.
And it's also interesting that the provinces of Ontario, Saskatchewan, and Manitoba were highlighted as feeling the most of this mental health strain. Why do you think that's the case, ma'am?
We were wondering if that was because of the recent lockdowns that those provinces have experienced. We know that lockdowns have been very hard on people. It's hard for small business owners. It's been very tough for people who live alone and are more isolated. And it's been particularly hard for parents if their children have been kept home from school and they've also been trying to earn a living. So all of those circumstances just add up to worse mental health.
And meanwhile, all across the board, we're seeing Canadian professionals in the medical field, education, and frontline workers really feeling the mental health hit. We're seeing a lot of worker burnout. We're seeing people leave their jobs. Can you tell us how this is likely going to impact those professions in the long run?
Well, we're very concerned about the impact for all Canadians in the long run, but it's been especially tough for hospitals and healthcare workers to actually find workers. We're also seeing this in the restaurant industry where people are leaving because there are no jobs there anymore, and they're not going back. They're finding jobs in other places. And we've seen in the mental health field, because there's been so much demand on the services for mental health care workers, that there are similar concerns about longer term shortages, especially as we see governments try to increase funding for mental health care. We're going to have a body of workers who can actually help us deliver on these increased services.
And on that note, what would you say are some realistic steps that the federal government can take to really address this issue across Canada?
Well, we were so happy to see that the federal government has created a minister for mental health and addiction, which is the first in the history of the federal government. The federal government has also promised a mental health transfer act, which is basically their way of ring fencing an amount of money. It'll be $5 billion over the next 10 years of spending just for mental health. We know the federal government is the largest funder of healthcare across the country, but oftentimes they do not make any standard or have any criteria for how that money should be spent on mental health. So this is the first time that we've seen them actually say we must address this mental health issue by clearly designating this funding for mental health. So we hope that that will increase access to care and reduce waiting lists across the country.
Well, we'll definitely have to keep our eyes on that, ma'am. A quick 20 seconds left here, but what are some resources that people can utilize right now to improve their mental health during the pandemic?
Well, if you are concerned, we urge you to get in touch. So go to our website at cmha.ca, and you'll see a number of different resources for dealing with things like the winter blahs, the results of the pandemic, but also you'll see access to free mental health care services that might just help you or a family member at this time.